there. Ever had one of those days where life takes an unexpected turn? Picture this: you're a teacher and a loving mom, and suddenly, your chest starts feeling weird. It's painful, swollen, and there are red marks. Weird, right? What could be going on? Is it something usual or maybe a bit serious? Ever wondered what you'd do in a similar situation? Let's chat about it, explore the story, and unravel the mystery together. What would you think if you were in Laura's shoes? Curious minds, let's jump into this journey. Laura, a dedicated teacher and caring breastfeeding mother, began to experience a sudden onset of sharp pain in her breasts. As the days passed, her breasts became swollen, tender, and warm to the touch. The discomfort escalated, accompanied by a burning sensation, particularly during nursing sessions with her baby. Hard lumps formed on her breasts, and she noticed ominous red marks. Concerned about her symptoms and fearing the worst, Laura decided to consult a gynecologist. The experienced gynecologist conducted a thorough examination and, understanding Laura's anxiety about the possibility of cancer, organized additional tests. After careful analysis, the gynecologist delivered the diagnosis: mastitis. Taking a moment to explain the condition to Laura, the gynecologist reassured her that mastitis was not uncommon, especially among breastfeeding mothers. She detailed the symptoms of inflammation, engorgement, and the potential for bacterial infection, emphasizing that timely and appropriate care could lead to a full recovery. The gynecologist outlined the common causes, highlighting the role of hyperlactation and oversupply of milk. Laura, listening attentively: "Doctor, what is mastitis?" Mastitis is painful inflammation in your breast tissue that can lead to a bacterial infection. Anyone can get mastitis. It's most common in women who breastfeed. Men and people who don't breastfeed can also get it, but this is rare. Doctor, how common is mastitis? Mastitis affects up to 10% of breastfeeding people in the United States. It may affect up to 30% of breastfeeding people worldwide. It's most common in the first 3 months of breastfeeding. And causes: Doctor, what are the symptoms of mastitis? Mastitis is inflammation. This means your breasts may be swollen, tender, or warm to touch. Your breasts may become engorged. You may also experience breast pain, mastalgia, or burning sensation that worsens when your baby nurses. Hard lumps on your breast. Red marks on your breast. Flu-like symptoms, including fever and chills if mastitis infection occurs. Engorgement is most common in the first few days after you give birth, but can occur as long as you produce breast milk. Doctor, what causes mastitis? The most common cause of mastitis is hyperlactation or an oversupply of milk. This oversupply of milk causes your milk ducts to narrow because the surrounding tissue puts pressure on the ducts. This leads to engorgement, which is when your breasts are extremely full and swollen. This is known as inflammatory mastitis. Inflammatory mastitis can lead to bacterial mastitis. Bacterial mastitis is when infection occurs due to inflammatory mastitis. Sometimes, a bacterial infection leads to an abscess. An abscess is a collection of fluid that requires draining. Risk factors for mastitis: you're at higher risk for getting mastitis if you breastfeed and have an oversupply of milk. In recent years, healthcare providers have changed their recommendation for dealing with oversupply. The previous recommendation suggested emptying your breasts more often would treat the symptoms of oversupply. However, current research shows that this actually makes engorgement worse. Emptying your breast more than usual, pumping or feeding, will only lead to more milk production and further aggravate the inflammation. Doctor, how is mastitis diagnosed? Your healthcare provider will do a physical exam and check your symptoms to make a diagnosis. If you aren't breastfeeding, you may get a mammogram or breast ultrasound to rule out breast cancer or a different breast condition. Doctor, what is the best treatment for mastitis? Treatment for mastitis involves reducing inflammation and pain and preventing an infection from occurring. Researchers are always learning more about lactation and mastitis, so it's important to talk to your healthcare provider to make sure you're getting current treatment information. Previous treatment methods for mastitis involved heat, massage, and extra pumping or feeding. Now, many providers say you should treat inflammatory mastitis like a sprained ankle. You wouldn't massage an ankle sprain or put a heating pad on it. Mastitis should be treated similarly. The swelling in your breasts is mostly due to swelling of the structures around the milk. It's not a plug of milk needing worked out. Rather, the inflammation needs to be decreased in order for the milk to flow better. At-home treatment for inflammatory mastitis includes ice. Use an ice pack or a frozen bag of vegetables to reduce swelling while laying on your back so the swelling drains into your lymph nodes. You shouldn't apply heat. Pain relievers. Using over-the-counter nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen can reduce swelling and pain. Lymphatic drainage. Lymphatic drainage involves gentle, light petting of a cat pressure of your breast toward your lymph nodes above your collarbones and in your armpit. It reduces swelling by moving fluid. This isn't as strong of pressure as a massage. Reverse pressure softening, RPS. This type of massage reduces swelling in your areola and nipple by moving the fluid away from it. It allows your baby to latch more easily to a full breast. To perform RPS, place 2 fingertips around the base of your nipple. Apply pressure, then drag your fingers away from your nipple. Do this at several angles around your nipple. Wear a supportive bra. A supportive bra isn't tight-fitting and doesn't put more pressure on your breasts. Do not massage your breast. Do not use any type of massaging device on your breast. Do not soak your breast in anything. Do not apply heat. Medications for bacterial mastitis. If at-home treatment for inflammatory mastitis doesn't help, it could progress to bacterial mastitis. Your healthcare provider will prescribe an antibiotic to treat a bacterial mastitis infection. They work to eliminate the bacterial infection that's built up in your milk ducts. The infection should clear up within 10 days. However, you should begin to feel relief within 48 to 72 hours. Over-the-counter medications like acetaminophen and ibuprofen can help with pain and inflammation, but they can't treat an infection. Doctor, what are the complications of mastitis? If left untreated, a breast infection like mastitis can lead to a breast abscess. This type of abscess typically requires surgical treatment. Your healthcare provider will perform minor surgery or use a small needle to drain the pus. Doctor, how long does mastitis last? Inflammatory mastitis usually gets completely better within 10 to 14 days. When managed correctly, symptoms improve dramatically within 24 to 72 hours. Recognizing the signs of engorgement and inflammation is key, because then you can start to implement treatment methods like ice and lymphatic drainage. Doctor, is it safe to continue breastfeeding when you have mastitis? Yes, you should continue to nurse your baby. You can't pass a breast infection to your baby through breast milk. In fact, breast milk has antibacterial properties that help babies fight infections. Antibiotics that your provider prescribes for mastitis are usually safe for your baby. It may be uncomfortable to nurse when you have mastitis, but you should continue to do so. Doctor, can I get mastitis more than once? Yes, it's possible to get mastitis multiple times. Doctor, how can I prevent mastitis? A good rule of thumb is to only pump what's needed for your baby. If you're feeding from your breast, don't pump afterward to drain it. A good latch may help with mastitis because your body can naturally adjust your milk production to your baby's milk intake. People who are breastfeeding can also take these steps to lower their chances of getting mastitis. Don't wear tight-fitting bras. Avoid using nipple shells or other devices on your breasts. Doctor, what can I expect if I have mastitis? Mastitis is painful and uncomfortable, but it usually doesn't cause long-term problems. At-home treatment using the methods above usually lead to positive outcomes. If you're nursing, you may make less milk as your body fights off the bacterial infection. Milk production should increase as you start to feel better. Doctor, does mastitis increase your risk of breast cancer? Mastitis doesn't increase your risk of breast cancer. However, mastitis symptoms are similar to inflammatory breast cancer symptoms. This rare type of breast cancer causes breast skin changes. Signs may include dimples and a breast rash that has an orange peel texture. Like mastitis, one or both breasts may become red and swollen. Inflammatory breast cancer doesn't usually cause breast lumps. Inflammatory breast cancer is an aggressive cancer. It requires prompt diagnosis and treatment. Laura, relieved to have a diagnosis and understanding of her condition, was grateful for the detailed explanation. The gynecologist discussed the recommended treatments, which included at-home measures such as ice packs, over-the-counter medications, and gentle massages. She stressed the significance of continuing to breastfeed, as it not only provided comfort to the baby but also aided in resolving the condition. As Laura left the clinic armed with information and a treatment plan, she felt a sense of empowerment in managing her mastitis. The gynecologist reassured her that with proper care, the symptoms would likely improve within a few days, and any concerns about cancer were alleviated. Laura, grateful for the expert guidance, embarked on her journey to recovery, balancing her roles as an educator and a nurturing mother with newfound confidence. And so, our journey with Laura, the teacher and caring mom, comes to a close. We've delved into the twists and turns of unexpected health challenges, discovering the resilience within us all. Now, as we navigate life's unpredictable adventures together, let's stay connected. If you enjoyed this exploration and want more intriguing stories and insights, don't forget to hit that subscribe button. Join our community, and let's continue sharing, learning, and supporting each other on this remarkable journey called life. Stay curious, stay engaged, and most importantly, stay tuned for more stories that resonate with the rhythms of our everyday lives. Subscribe now for a front row seat to our next captivating chapter.